Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast. This is Dan Carter with Dr. Caroline Brown. We're at the studio at Countryside Equine Hospital. You picked this topic.
I did, because if you're watching this right now, it is Halloween.
Yep.
It is Halloween.
Yes.
So we're doing a spooky, scary topic today.
It is kind of terrifying.
It is. It's like I was like going through my brain. I'm like, what is the one thing that like truly scares me? And it's rabies.
So we're a little spooktacular. We're talking rabies.
Rabies.
Yes. You know, I want to start this segment off because a lot of people are thinking, like, why am I listening to a podcast on rabies? This is the most important podcast you'll ever listen to. Yes. Because what is the survival rate for people infected from rabies?
0.
Can you say that again?
0.
0 survival rate.
Yes. If anybody says they've ever survived rabies, then they're lying to you.
Actually, I think there was one. It was like back in the it was either late 1800s, early 1900s. Mm-hmm. It was the dude that first kind of came up. It's like, because this is like where vaccines started, was rabies.
Yes, I have a whole segment about that. So,
but there was one girl that actually survived a rabies attack. Mm-hmm. But yeah, so there was one. Mm-hmm. You decide who you want to be.
Yep. It is entirely preventable. We have wonderful vaccines for it. We're going to talk about rabies laws in here and how that's completely changed the landscape of rabies, at least in this country.
Right.
And how it's extremely rare nowadays here. But, you know, we're going to talk about all the spooky, scary, and why there are so many laws around it.
Well, y'all buckle up and hold on. We're going on a rabies ride.
We're going on a rabies ride.
Let's do this.
All right. So rabies is a Lissa virus. So this is a really interesting little virus that it's very, very good at what it does.
Yep.
It is very good at what it does. So this rabies virus is going to be present pretty much all over the country. Mm-hmm. There are reservoirs all over. There's different wildlife species that kind of carry it in certain areas. In this region, in Georgia and kind of on the Atlantic coast, raccoons are kind of our main carriers of it. But across the United States, you've got bats, skunks, foxes. The majority of rabies cases that are presenting in the U.S. in humans come from bats. More than 50% of them come from confirmed bat exposure.
Well, and do not forget, because I think this is important, the feral cats.
Feral cats, yes.
People do not think about the feral cats. Mm-hmm. But you need to be cautious. Like, just because you see a cat, you find a kitten just running around somewhere, like these animals carry rabies too. Mm-hmm. That was a big issue about 8-10 years ago when the feral cat program was really big.
Interesting.
Yes, and they realized they had released some wonderful vectors for rabies.
Well, and feral cats are a whole, like...
we're not going to get into that.
That's such a whole hot topic, like, in and of itself, and how they're basically, you know, an invasive species in the population. But, yes, they are a reservoir, technically, of wildlife rabies.
Yeah, because actually a few years ago, cats became the #1 vector of rabies in the state of Georgia.
Interesting.
Yes, actually beat out bats.
Wow.
It didn't last long.
No, but I mean, it just tells you how prevalent they are.
Yeah.
And again, it's as we'll kind of talk about a little bit, it's not a common disease in humans, but it's present in wildlife. There's so much going on the wildlife side that we don't know about, that they're finding these suspect cases and intervening and doing things before we even hear about it.
Yep.
That, you know, it's basically stopped it from becoming such a public health risk, but it's still there.
Still here.
It's still there. So rabies is, we'll kind of talk about how rabies turns into these clinical signs. If you've ever seen, Old Yeller or Cujo, you know what's going to happen.
Yep.
But the rabies virus is present in the saliva of the infected animal, and it enters a new host through a bite wound. And then this little virus is, again, it's very good at what it does. It gets into the tissues and it just starts to rapidly multiply, just producing thousands, millions of copies of itself in this one site. And its goal is to get into the nervous system. So it starts by traveling from these tissues that it entered through, getting into the peripheral nerves, and slowly making its way towards the spinal cord. And once it's in the spinal cord, that thing starts trucking.
It's like game on.
It's game on. And now it's got millions of copies of itself. And this moves fast. Once it's in the spinal cord, things are moving fast. And it's usually going towards the brain. There is some forms that kind of seem to primarily affect the spinal cord. But the brain is kind of where you get these very typical signs of rabies. And it's said to infect the salivary glands of these animals before the clinical signs even start to show, which is kind of terrifying.
That's the scariest part.
Yes. So before these, animals even start acting strange, it's already in their salivary glands.
Yeah, it's like a ninja. It's
there, yes. And then usually once these clinical signs do start to show, there's about a 3 to maybe 10-day period of these signs presenting before they eventually pass. So again, these signs that you see, again, if you've ever seen Old Yeller, you know what it is. There's kind of two forms of it. There's the encephalopathic form, which is the primarily brain form, which I think is the most common that we see. And then there's more of a paralytic form, which is typically affecting the spinal cord more than it ever gets to the brain. So these encephalopathic forms, the very classic one is the furious rabies.
Yeah. So
these are these animals that have a complete loss of humans and they just want to bite everything. Your kind of typical presentation of this is, raccoons and foxes that are out in the middle of the day and they're approaching you.
Yeah, they're like trying to attack you or trying to come up to you. Like a wild animal should run away, but this one's not.
This one's not. If it is, no, get away from it.
Yeah.
Get away from it. Something's wrong with it. They're very restless. They're very nervous. They're very agitated. There's this idea about hydrophobia or this fear of water. What is actually happening with that is they have this like pharyngeal paralysis that they can't swallow anything. And so that's where it comes from, but that's where all that foaming from the mouth comes from. They're not able to swallow, so all the saliva is just collecting in their mouth, and it's Cujo.
Well, and the other thing, because you can have some variances of this furious form, is I want you to think about a couple things. This is what I point out to people. Excess salivation. Horses salivate a lot sometimes.
Yeah, they do. Yes, they do.
Fear of lights and sounds. Basically, they're like spooky.
Yeah.
Horses spook a lot. One of the number one presenting signs is actually colic.
Yes.
And what does everyone do while they're colicking or having these things going on? They get their hands all in these horses' mouths. And remember, it can be shedding for 3 to 10 days in the salivary gland prior to clinical signs.
Yes.
So that's one of the things I always tell people is that I think that's why this disease is so terrifying. By the time you know it's rabies, it's too late.
It is, yep.
At least in horses.
Yes. Horses are very interesting. I've seen 3 cases of rabies in horses in my 4-year career. I've seen 3.
Dang, you hold a record. I've had 1.
So, granted, one of those was a video from a friend of mine who saw it, but
still counts.
I think it still counts.
Still counts.
It's so rare.
Yeah.
2 of them were this furious form, but the other one was what we call the dumb rabies or
dumb
the
rabies,
obtunded, where they just turn into a zombie. There's no thoughts, there's no action. They're just standing there, just completely. They won't move. They won't react to anything, and those ones are scary too because again, it can look like a colic.
Look like a colic, look like a choke, just an ADR.
Yes.
I mean, that's the scary part to me.
Yeah. And it's thought that a lot of livestock rabies don't really turn into this super aggressive one. They tend to present more in this kind of obtunded rabies.
Mine was, it was like, the one I had was kind of weird because it was somewhere in between. It would stand there, they actually called because the thing looked like it was just out of it, like dumb. It was the dumb form where it's kind of standing there. But then any kind of lights, sounds, quick movement, it would turn and become very aggressive and charge at us. So, but then once everything calmed down, and we're talking about 2 to 3 minutes later, it would calm down, and it would be back over in the corner of the stall, just out.
Yeah, weird.
But then trigger and go to furious.
Weird.
I'm like, fan-freaking-tastic. So, yeah, that's, and so, I mean, and like I said, the part I want to reiterate one more time, because they say you need to hear things 3 times. Clinical signs, or they can be shedding virus for 3 to 10 days in the salivary gland.
Yes.
Before showing clinical signs.
Yes. Which is, again, these colics, we had one that this horse was choking for like a very long time, and it just didn't make sense. And there was a thought in my brain that I'm like, oh crap, what if this is rabies? And this thing has just been salivating all over me. It wasn't that, but
yeah, it goes through your mind.
And it's, once that thought hits your brain when you're like working on a case and you're like, something just isn't right, and that rabies thought crosses your brain, like you just cannot get that thought out of your head. It's, yeah.
I mean, my thing is I'm vaccinated.
Right.
I'm going to make it.
But what about everybody else?
Well, I mean, I'm just saying. I'm going to make it.
Listen, if you start trying to bite people, dude,
Yeah, I know.
we're taking you out.
So yeah, and then the paralytic form of rabies. Like this is that's an interesting one. I haven't seen one of these.
I have not seen one of these, but it's one of these things too. When I was kind of reading into it, they're like, is it more affecting the spinal cord because it just hasn't made it to the brain yet, or is that like its final destination? It's not really clear on that, but it's this ascending flaccid paralysis in these horses where they're falling all over the place. Their back legs aren't working. They do this like kind of dog sitting position, and again, people think it's, a weird EPM attack, or they broke something, or
one of the things too, because like I said, that does look a little EPM-ish. But one thing I love to tell people, I'm like, did it get better? They're like, yeah. I said it wasn't rabies.
It wasn't rabies. Yeah.
That's the one rule you can count on. If it got better, it wasn't rabies. They die every time.
Yes.
But yeah, I haven't seen one of those. Like I said, the one I saw was a mix of furious and dumb.
It sounds like it's primarily going to the brain, but I guess there's enough people that have reported this flaccid paralysis that they have their own thing. But again, it was is it just, it never made it there? Because again, with most of these things, if we are seeing these signs and we are very suspicious of rabies, there is no diagnostic test to say, yes, you have rabies or not, that we can do pre-mortem.
Yep, that is, because you can't use a titer, because a titer could be there from a vaccination.
Yes.
So literally the only test we have, unfortunately, is antemortem. So it puts a lot of pressure on us because you're walking this line, right?
Yes.
Because you really don't want to euthanize somebody's horse to test it and it not be rabies. But at the same time, you don't want to not do that and have it be rabies.
Correct.
So I can say this is one of the more difficult. This is the one case I had, it was a much more difficult decision. Because like everything looked like rabies, but you're like, if I'm wrong,
we just
kill the
euthanize
horse.
something. Yes. But, well, it sounds like you got your confirmation.
Got the confirmation.
Yeah. So
The poor lady was actually scheduled to have a brain tumor removed the following week.
Oh.
And so, needless to say, I am on the phone with the hospital saying, you need to call me now. And the doctor is doing doctor things where he doesn't want to call me. And I'm finally like, you have got to call me because this is a major issue. You're going to make the news. He called me. We postponed.
You dropped that R word, so
Yeah. I mean,
again, nothing stops people in their tracks like just saying rabies.
Yeah, and that was his first time. Mm-hmm. But yeah, it's a terrifying thing, all the way through from when you first start to suspect this to making that decision. Because let's get into diagnosis. There's only one way to do this.
Cut the head off.
Yep, unfortunately.
Cut the head off.
We have to get tissue samples from the brain.
Yes. So it's an immunofluorescence test that looks for the antibodies in the brain tissue. Mm-hmm. Yep. And there's certain labs that will test it. So if we have a case and we are suspicious of rabies, there's handling that we have to specifically go through, that the lab has to go through, and how they test these cases. We have a very good test, and it's usually a pretty quick turnaround.
Very quick turnaround, very important.
Yes.
Yeah. And unfortunately, that's it. Cannot pull blood and check a titer.
No.
No test where they still get to live.
No.
So.
Yeah.
We've given a lot of bad news.
Yeah. It's not a very, happy topic.
No. But look at this segue. Great news. It is probably the most preventable disease we have.
Yes, it is.
This is some science here. This was the first vaccine.
It was. So this gets into my fun history topic.
After you said that, I looked at the paper and I saw it. And I was like, I'm pretty excited. Let's do this.
I love little disease history things like this. This is my I'd nerd out over this. So rabies has been reported in ancient texts from all over the world for thousands of years.
Right.
For pretty much as long as humans have lived with dogs, there's been reports of rabies. And there's all these, laws, if you go back into ancient civilizations, about what they would do if there was, a mad dog on the loose or something, or, even just how to keep your dog away from other dogs and to prevent this spread. They didn't know what it was, but they just knew that dogs would go crazy and start biting people, and then
it's like mad dog disease.
Yes, it was. So it's interesting, and there's all these old, very barbaric methods of treating this. They thought that cauterizing these wounds would stop the spread from it. It didn't. This is where the phrase "hair of the dog" comes from.
Nice.
Where there was thought you make a little potion with the hair of the dog that bit you, and you drink that, and it prevents the rabies. Spoiler alert, doesn't work.
But I mean, I can see where vaccines coming from now, because they're starting to think this way. Okay, keep going, keep going. I'm getting excited.
So our good friend and hero, Louis Pasteur, is the one that finally figured it out. He started taking live tissues from animals that had rabies. I think he used a spinal cord from a rabbit for the first one that actually worked, and he started inoculating dogs with it and then exposing these dogs to rabid animals, and these dogs all survived.
Crazy.
So he created the first vaccine. Granted, it was a live vaccine, which is terrifying to think about now that we know that the vaccines are now killed, but it's really interesting. So he did this in 1884, and then a year later is where we had the first instance of a human actually getting this vaccine. Mm-hmm. It was a little boy named Joseph Meister in Germany. He was attacked by a rabid dog. They rushed this boy to Paris so he could go meet Mr. Pasteur. They gave him anywhere between 12 and 13 injections of this vaccine over the span of 10 days, and this boy survived.
I mean, he's the first person to survive rabies.
Yes, he is, and it's because of this vaccine.
Man, old Louis, he was something,
So he's kind of the father of the modern vaccine. He did the rabies was kind of one of the big ones he did. I think he did something for cholera, smallpox as well. Mm-hmm. So he's quite the guy, and World Rabies Day is actually his death day. So
oh wow,
yes,
that's pretty cool. Should have been his birthday,
I know. I was like, what are they gonna do on the day he died, man? But
and he pasteurized milk.
Yes, he did. Pasteur.
So, Pasteur. Yeah, pretty cool dude. First vaccine. Dogs are
Yes.
living. Joseph Meister survives.
Uh-huh.
And you know what? I would probably say this is the most effective vaccine that has ever been created.
Yes, yes. Just kind of getting into like some numbers in the last maybe 20, 25 years, there have been only 20-ish cases of rabies in the United States.
Yep.
It's thought that there's about 60,000 worldwide, and most of these reports are coming from Asia and Africa, where most of the attacks are coming from dogs, but they don't have rabies laws here. Here, we started implementing our rabies laws kind of around the 1940s, and that's when these cases just started dramatically dropping.
Right.
And you really just don't hear about human exposure anymore because we have such a good vaccine program in our pets, which are kind of where a lot of these things tend to be coming from. And we have really good protocols for post-exposure rabies.
Yes. When in doubt, you get post-exposure.
Yes.
You know, and that's one of the things veterinarians, we're actually required.
Yes.
Before we can go to clinics, before we can, mine happened freshman year, we had to get vaccinated for rabies. I'm a fan.
Yes.
I don't want rabies. When you're looking at it, the effectiveness, we'll get into it. I mean, like I said, it is probably the best vaccine we have
Yes.
as far as preventing disease.
Yeah, these pre-exposure vaccines, they're given to populations of people that have the highest risk of exposure to rabies, so people in the veterinary field, people that work in shelters, people that work with wildlife, people that research bats in caves and
You would think
things.
they'd have it.
Yes, they do. It used to be a 3-shot series. Apparently, in the last 2 years, they changed it to a 2-shot series.
Really?
Yeah.
I'm like, go ahead and give me that third one.
Yeah.
I'm in. Give me the third one.
You get your titers checked after the first 2 years, and if you're good in that time, they say that you're good. They used to say we were supposed to get our titers checked every couple of years, and now they're like, nah, if you're good, you're good. So.
Well, and that's the thing. If you've listened to our vaccine podcast too, that's one thing I want to bring up. We did a podcast on vaccines, and one of the things to remember is when you're talking about luckily humans have fantastic memory.
Yes.
In the immune system. Horses, their immune system's terrible. Like, they don't remember anything.
That's true. That is so true.
They have no memory.
Yes.
So when you're thinking, like, you hear us talk about we got vaccinated, you know, mine was, 20 years ago, and I'm still holding great immunity to it. Yeah, horses don't do that so well.
But also, if we are dealing with a confirmed case, we go get the post-exposure.
We do.
Is too. And that's kind of the other thing too, is that, you know, people that are high risk working with these animals where they're going to most likely be coming into contact with rabies, we are taught that, you know, there's certain protocols we have to do if we suspect rabies, and if it comes back as a confirmed case, we get the post-exposure vaccines.
Right.
So post-exposure, you've got a couple different protocols. It's a day 0, 3, 4, 14, and 28. It's a 5-dose series if you've ever had to get one. If you've been vaccinated, I think it's only a 3-dose series. I know one person that had to get the 5-dose series, and it is not a fun vaccine. No. I remember mine hurt a lot. Like, I don't normally react to vaccines, but like just getting my pre-exposure ones, like, I was pretty sore after those.
I was too.
Like,
The first one wasn't bad. The second one wasn't great. That third one?
that third one knocked me out.
Yes.
Yeah, like,
And I had a farrier contest that weekend. And of course, we get it on Friday, or I think we got it on a Friday, and I was competing Saturday. And so I'm over there like, great, my arm hurts. Yeah.
so my like rabies vaccine story is like really weird because we got the email from like our school that said, hey, you need to go get these. And most people had to go to like the state health department to like go get theirs because most places don't carry it. I walked into a random CVS on my college campus and said, you guys have a rabies vaccine? They're like, yeah, you want it? I'm like, yeah, sure. So I just walked in off the street and got it. So
We all grouped up, went down to the school health center. They ordered it all in, so we were literally going in as like groups.
yeah, I told people that too because there were a lot of people in my class that were like having a hard time like finding where to get it without having to like, you know, go to the state health department. I'm like, just walk into your local like Walgreens and see if they got it. And people are like, that didn't happen. I'm like, it did. It did. It was crazy.
So let's talk about vaccination in horses because, like I said,
Yes.
this is the most preventable disease we have. And I got a goal, and that's like, let's don't have any more rabies.
No more rabies. So there's actually a whole push to try to eliminate rabies in the United States by the year 2030. So
I don't know that we're
I
going to
don't
make
know.
that
I was
happen.
like, we're getting a little
Too
close,
much
but-
wildlife. I
Yeah.
mean,
but we're trying. So
yeah, I hear you.
we're trying. So there's rabies laws in every single state. In the state of Georgia, the rabies vaccine is only legally required in dogs, cats, and ferrets.
Interesting. I didn't know about ferrets.
I don't know why. I can't find any good reason as to why ferrets need to be vaccinated, but they do. And it must be administered by a licensed veterinarian. You cannot just go to Tractor Supply and go buy rabies vaccine.
Nope.
So in horses, it is not legally required to vaccinate them. However, we consider this a core vaccine.
Yeah, like this is the one vaccine. I don't care if you get any other vaccine. I'm going to beg you to get rabies.
Yes. So, and the reason for this is because horses are still considered livestock in this country. The same as cattle, pigs, everything. And any mammal can technically get rabies, I think, except for possums or something.
Possums aren't mammals.
Yeah.
They're marsupials.
Oh. Is that not a mammal?
No, they're marsupials.
I didn't know that. I'm learning things.
Yeah, possums are marsupials.
Well, they can't get rabies, so. But where was I going with this?
Because their body temperature fluctuates.
Yeah.
Yeah, their
The
body
more-
temperature can get too low. They're marsupials, not mammals.
The more you know. So, yeah, but it's not considered. Apparently the reason it's not legally required to vaccinate horses, cattle for rabies is because economically it doesn't make sense for people with, hundreds or thousands of head of animals. However, horses kind of walk a weird line between companion and livestock, so we tell people, listen, vaccinate them for it. They're still at risk for exposure. They're going to encounter wildlife. They're going to, be susceptible to bats flying around. They can still get it. So we tell people, vaccinate your horses. We can start vaccinating them at about 4 to 6 months of age, and we booster once a year. It's a very easy little vaccine.
Very. And again, it goes back to why do we have to vaccinate them once a year? Terrible memory.
Terrible.
Terrible memory.
Terrible.
So, little quick review. Once we give a vaccine, it's not just about the titer. The titer is circulating antibody. When we give a vaccine, we have circulating antibody, but we also create a memory B cell. And these memory B cells are what, when the body sees this virus, all the antibody goes to fighting the virus. But a dendritic cell, a macrophage, one of these cells runs over the lymphoid tissue, tells this memory B cell, like, hey, rabies has showed up. I need a bunch of rabies antibody because we ain't got enough. And these memory B cells start cranking it.
I said, not in my house.
Humans have great memory B cells.
Yes.
Tons of them. Horses, not so much. They
No.
make a bunch when you vaccinate, and then they just start rapidly declining. So you can actually run out of antibody before it can before it can finish fighting the disease.
Right. Which is why we recommend a lot of our vaccines at least twice a year.
Right.
Because there is so much exposure to these things, and they just have terrible memory for it.
Terrible memory.
And rabies, again, in dogs and cats, they have these 3-year rabies vaccines, which have proven to work really well. Horses, that is not an option.
No.
We can't do that.
And I even struggle. Like, I'll be real honest. I get there's a 3-year vaccine in dogs for rabies, but I live in fear of rabies. Mine's getting it every year.
Oh, really?
Yeah, I'm a 1 year. And that's the other thing is, like, when you're talking about dogs, that varies state to state and varies county to county
Interesting.
on the 1 versus 3 year. There's no
Really?
statewide mandate. This is all set by county health departments. So you need to always know what county you're in.
Yes.
So you know whether they recognize a 3-year rabies or not. So that's important.
Yes.
But in the state of Georgia, must be administered by a veterinarian. That's the law.
That is the law. And that's why you get your little tag for your county that says that this animal was vaccinated. That tag is specific to that animal. When we administer a rabies vaccine to a dog or cat, we have to, say this is the animal it was. We have to give the serial number of the vaccine that we used, prove a date. You get a little certificate, and it's good for a year. or 3 if you're getting a 3-year. But
And if your animal is vaccinated in another state, not by a veterinarian, Georgia will not recognize that vaccine. Mm-hmm. They only recognize vaccines given by a veterinarian.
Correct.
So if you do not, it was not given by a veterinarian, the state of Georgia sees it as an unvaccinated animal. And there's a lot of laws circulating around about that versus vaccinated or unvaccinated, but that's more small animal. We won't get into that.
Yeah, I didn't do enough research on that side. We that's a whole. I had like a whole class on just rabies laws.
Oh, there's a ton. And that's the one thing. Every time we get licensed in different states, the first thing that we have to learn for that state is the rabies laws.
Rabies laws, yes. Even if we're not really working on dogs and cats,
we have to learn the rabies laws to be licensed in that state. I got a license in like 10 states.
And that's the first thing.
That's the majority of what I have to learn is the rabies laws.
I mean, even then, like, because people will ask us, like, hey, can you vaccinate our little barn cats? And I'm like, I mean, there's a whole process we still have to go through. We still have to administer them a tag, even if they're a barn cat.
Yes.
And
that's the other thing is, think about that. If you've got dogs and cats around your barn, especially barn cats, a lot of people don't think about them. If you've got barn cats, these animals need to be vaccinated.
Yeah.
Because they can get rabies too.
If you can catch it, I'll poke it.
Yes.
I will. I'll do it. I'm just not catching it.
I'm on a mission because, like I said, again, going back to that, they're shedding virus for 3 to 10 days prior to showing clinical signs. That's terrifying to me.
Yep.
That is terrifying. But the vaccine is very, very good. And I'll be honest, it's not. It's one of the. Well, depending on which one you pick, it's not a highly reactive vaccine either.
No, it's
depending
not.
on which one you pick. Now, there's one out there that it is very reactive. But I always said, like, if I had a rabies outbreak, I'd probably get that one because they mount one heck of immune response. But they're going to be sore.
Yes. So the idea behind the post-exposure vaccines, we'll kind of talk about that. The idea behind it is that it's going to mount the immune response and stop this like crazy replication of this virus that's happening when it initially enters the body. Because again, that's where rabies gets a lot of its virulence, is that initial just multiply as much of myself as I can. So if we can stop that in those first couple of days, that's where we get our big win.
Right.
So if your horse if you give us a call and you say, hey, my horse just got attacked by a dog or, a raccoon or something that we're suspicious for rabies, even if we're not, we're going to booster them immediately within 96 hours of this exposure. And then we're going to watch them for 45 days if they've already received a rabies vaccine in the past. If they are not vaccinated for rabies, if they've never had a rabies vaccine ever in their life, and we see that they've been attacked, and this animal that attacked them is suspicious for rabies, we have to do a 6-month quarantine. And that is a very strict quarantine of they do not need to have any exposure to anything. And I don't even know if that's anything we talked about of when you get these, after the attack, how long it takes for you to start even showing signs.
Right.
It can be anywhere from a couple of weeks to several months. There's one case in humans that they said it took 8 years. I don't know how they confirmed that.
Yeah, I don't either.
But I'm like, but sure. So this 6 month that's a long time.
Well, one of the things, like I had a case that was an exposure. Call comes in. It is a skunk attacking a horse. So clue one, skunks don't normally go pick on horses.
No.
But literally this skunk is out there attacking this horse.
Yeah.
So if you see that is abnormal behavior.
That is rabies all day long.
Yeah, skunks don't usually come out during the daytime. 2, skunks don't normally attack horses. So this skunk is attacking this horse in broad daylight. And the guy, he has to kill the skunk. He shoots the skunk because this thing will not stop attacking his horse.
God.
Well, when he calls in and says, hey, what should I do? I'm like, 1, don't touch anything. We're on the way. Again, we're vaccinated. We're trained in this. So we get there, and the first thing we did, get the skunk, send it off for testing. Guess what? It was positive for rabies.
Shocker.
And then I had to institute a 6-month quarantine of the horse. We started the post-exposure vaccine series, 6-month quarantine. And the first thing I told him was like, you can throw hay over that fence and you can throw feed. Farrier doesn't get to come out. It's going to have some long feet. Hate it for you, bud. But again, we're dealing with a disease that could be potentially fatal. And we'd go by and check on this horse. The horse made it. The horse was fine. Post-exposure worked. We got 6 months out. We were able to release it from quarantine. It was something I work with the state on because, again, that's the first call we have to make is to the state.
And say, hey, we've got a problem.
Right.
And that's the thing is, you know, if we've had these cases, I've had a few where I am suspicious of something. First thing I do is call the state.
Right.
Because they're going to give us the best direction on what we need to do with the animal and then what anybody who's been in contact with that animal needs to do. So they may even say, hey, we haven't gotten a confirmation yet, but you need to go down to the state health department and go talk to somebody. Right. And at least start the post-exposure.
Yeah, that's what we did in this case. The gentleman whose horse it was, he started the post-exposure. Because, again, you know, he wasn't 100% thinking rabies. In fact, when he called, he was like, what I need to do, the skunk bit my horse. And I'm like, we got a problem here. Yeah. And so, again, we're going to get in touch with the health department. We're going to come out. We're going to get some testing done. We're going to set up quarantines. And it's very important in these quarantines that you have to quarantine correctly. Because, like I said, this is not something you want to play with.
No. This is, again, if you get this and you don't get the post-exposure and you start showing signs,
you're going to die.
You're going to die. You will die.
Yes. Let's don't play with this.
No. This is, again, I'm like, spooky, scary topics.
Right.
This is my spooky, scary topic.
I mean, it's one of the few zoonotic diseases we deal with on the horse side that can really cause issues.
Yeah, because and you know we're gonna get onto our little vaccine pedestal here, and people are like, well, I don't want this in my horse. I don't want these. I'm like, listen, we're gonna pick one thing to vaccinate for. Do the rabies.
You can think about it, you're riding your horse. Your hands are in the mouth putting the bit in there. You know, horses are taking treat like this stuff's shedding. This is the one vaccine that, because again, this is 100% preventable. Yes. This vaccine is so efficacious. I get it. We've got some vaccines, they're not great. Like we talked about the other week on strangles. Is that vaccine good? No, not really.
Not really.
This one's good.
Yes.
This one is good.
If you look at the numbers don't lie. The number of cases in this country has decreased significantly since we implemented these laws. Yes. And then you look at the rest of the world, and there's a pattern. So.
Well, it's kind of cool. I work down the Caymans, and they are rabies free. No rabies in the Caymans, and I'm like, how awesome is that? Like, you live in a world you don't have to worry about rabies. Yeah. And it's very interesting because when we're doing import work in there, that is their number one thing. How do we not let rabies get in this country? And so I think if you do happen to live in one of those rabies-free areas, like...
I think they said Hawaii is the only state in the U.S. that, has absolutely no rabies either.
No rabies.
Yeah. But again, I mean, it's very strict about what comes in and out of there.
Yeah,
so.
Go Hawaii.
Yeah. I know there's very strict laws, too, if you're importing dogs or cats into the United States about what they have to have. So...
Because it is worldwide. It's not a North America thing. It's not a Europe thing. It's not an Africa thing. A South America thing. It is a worldwide. It is everywhere.
It's everywhere. It's been going on for a long time.
Yes.
So.
Vaccinate.
That's all right.
Terrifying disease. Thankfully, highly preventable.
Highly preventable.
So that was good. I mean, that was kind of some terrifying stuff, but at the same time, Ian's happy because we can prevent this.
Exactly. And it's been going on for a long time, and hopefully one day we'll stop it, but
it's going to be tough. Like, because when you just think about all of the, the wildlife is that big reservoir, and like, how do you get it out of wildlife? I mean, it's just
right. But again, that's the thing is like, I don't even think we are aware of how much just the people that work with wildlife on a daily basis are stopping this, that they themselves are finding things and just getting rid of the threat.
Yeah.
Like, I mean, I remember when I was in vet school, our wildlife, department was huge. And if there was a bat that came in, there was such a big protocol on what had to happen with that. Like, we have a whole bat conservatory in Gainesville that they do an amazing job with it. But I'm like, I don't even want to know what stuff they have going on over there.
I kind of want to stick up for the bats for just a second too, because I'm a fan of bats.
I love bats.
Bats can decimate insect populations, and I think the reason I really like bats is I hate mosquitoes.
Yes.
And I can't remember how many mosquitoes bats can eat in a night, but it's into the thousands.
Yes.
I mean, unfortunately, that's where they get the rabies from, is a mosquito bit an infected animal, and then the bat eats the mosquito. But you have to come in contact with the bat.
Yes.
And so a lot of people freak out. They're like, oh, there's bats. Well, like, you have to come in contact with them. And most people have bats all around them at night and have no idea these bats are out there.
Right, right.
And most of the exposure to bats is because you, like, walked up in their house at the wrong time.
Yeah.
Like, you have to really work hard to get bitten by a bat.
Yeah, I remember when we were in Mexico, we were in some of the like underwater caves, and there's just bats like flying all around your head, and like the part of me like was just freaking out a little bit. And remember the guy was like, no, like these are not the type of bats that are gonna come at you. Like don't swat at them, like don't do anything, and like they're just gonna be buzzing around. Like they're not gonna bother you.
Right.
Like so
yeah, like,
you're good. Like
yes, bats carry it. Yes, bats are a problem, but unless you're like a cave explorer or you're going into like heavily infested areas with bats, like into their house,
and you're handling them on a regular basis.
Your risk is pretty low.
Yeah,
so
I think they still tell people like if you find a bat in your house, like you're supposed to go get the post-exposure. Like, I
don't know.
I don't know. Don't take that kind of medical advice from us. We're not human physicians.
I do know that bats are protected.
They are protected. Yes.
You cannot kill bats.
No, you cannot. No, you cannot.
But like I said,
and if you put a bat house up in your neighborhood, your HOA can't tell you to take it down.
That's very, very true. Like I said, I like bats. They eat a lot of bugs, especially mosquitoes. They eat more than anything else out there. So don't be hating on the bats just because they carry this. But at the same time, like, be smart. Like, don't be like, oh, let me go pet this bat. That's a bad idea, okay?
This is a pro-bat podcast.
Yeah, we're pro-bats.
We're pro-bat here.
Anti-rabies, pro-bats. Mainly because they hate mosquitoes, and I hate mosquitoes. So, I'll tell you what, Caroline, this is a great podcast. I really enjoyed this.
This is fun.
We got some history in there.
Yes.
Birthplace of vaccines, rabies. We got to talk about one of the oldest known diseases.
Yes.
Got to bring up some literature with Old Yeller.
I didn't even talk about the whole werewolf thing. Like, so
I didn't even think about that. Yeah.
Oh my God. I had like a whole thing about this too that I didn't even get into. So yeah. But
so that's a great deal. Well,
yeah.
Thanks for being here today. And
Thank you.
I always say that, but you work here, so
I have to be here.
You kind of have to.
Yeah.
Yeah. But thanks everybody for tuning in. If y'all have got questions, keep sending it to us. For listeners in other countries, make sure on the topic of rabies, you understand what the rabies situation is in your country, because we've got listeners in what are we up to 50-something countries that are listening to us. So understand what the risk is in your country.
Yes, I'd be curious to see people in other countries, like what, if there are any laws, what are they?
Yeah, that'd be interesting to know. So if any of our listeners can throw that up there, I'd be curious to know. I think the other place, I'm pretty sure New Zealand is rabies free.
I think so. I think I've heard that.
So yeah, if you're listening to us in New Zealand, Caymans, Hawaii, guess what? You can just ignore this podcast because you don't have it. So, but yeah, it'd be interesting to know. But thanks to all listeners out there. Casey, thanks for doing all the editing on this. April, thanks for recording everything. And to all of us here at Countryside Equine Hospital, we hope you have a great week. Y'all take care.
Bye. Don't pet any raccoons.
Yes. Where's wisdom?